Hello and welcome to tonight's webinar, The Secret to Dermal Remodeling and Skin Revitalization with Cutera Secret RF. Tonight's presentation will last for approximately 45 minutes, followed by a 15-minute question and answer session. Questions can be submitted through the question feature located on your screen. Please send all questions to the host. Tonight's presenter is Dr. Marc Yune. Dr. Yune is a triple board certified facial plastic, cosmetic, and reconstructive surgeon by the American Board of Facial Plastic and Reconstructive Surgery, the American Board of Otolaryngology, and the American Board of Cosmetic Surgery. He is also a fellow of the American Society of Cosmetic Breast Surgery. After graduating with honors from the medical school and residency in head and neck surgery at Indiana University, he was selected for 1 out of 37 fellowships in the country in facial plastic and reconstructive surgery with emphasis on cosmetic facial surgery. His thesis paper for completing his fellowship was a DART procedure. The fellowship sanctioned by the American Academy of Facial Plastic and Reconstructive Surgery was administered by the recognized authorities in association with Emory University in Atlanta, Georgia. During his fellowship, he served as a clinical instructor for Emory University, training other physicians and residents while working with leaders in the field of facial plastic surgery to achieve the highest level of training available. He furthered his education in cosmetic breast surgery and tumescent liposuction through a variety of preceptorships, primarily in Southern California, over a period of several years. He continues to further his education through the American Academy of Facial Plastic and Reconstructive Surgery, the American Academy of Cosmetic Surgery, American Society of Cosmetic Breast Surgery, American Society of Cosmetic Physicians, and other various societies. Dr. Yune is a recognized authority in the field of facial plastic reconstructive and cosmetic surgery. He has authored and lectured nationally on numerous topics related to these fields, with a particular emphasis on facial rejuvenation through eyelid surgery and facelift, rhinoplasty, breast augmentation, and tumescent liposuction. He has developed and authored techniques on revision rhinoplasty and revision breast augmentation. He is a volunteer surgeon, past spokesman, and fundraising chairman for Face-to-Face National Domestic Violence Project. He is a volunteer surgeon for the Atlanta Smile Foundation. He is a founding member of the Georgia Society of Cosmetic Surgery. He has been featured on CNN, NBC, CBS, Discovery Health Channel, She TV, Women's Entertainment Network, Time Magazine, New You Magazine, and a variety of other media. Dr. Yune is committed to excellence in the highly specialized fields of facial plastic and cosmetic surgery. And now, I would like to turn the session over to Dr. Yune.
So thank you, Gina, and to Cutera. Tonight we'll be talking about the secret to dermal remodeling. My name is Marc Yune, and I'm a triple board certified facial plastic, reconstructive, and cosmetic surgeon with practices in Roswell and Greensboro, Georgia. We have multiple specialties, including the practices I just mentioned, as well as dermatology, aesthetics, wellness, and even allergy testing. We do everything from minimally invasive to surgical treatments, focusing on cosmetic. And so tonight we'll be able to cover Secret RF, one of our favorite non-invasive devices. So in terms of the market overview, skin rejuvenation platforms and disposable revenues will expand by over 14% per year to nearly $1 billion in 2019. And with over 70% of today's patients bothered by fine lines and wrinkles and textural issues, as well as dyschromias, that's what makes this device so pertinent. 80 million women over the age of 35, which makes greater than 15 million who are interested in non-surgical treatments with a less than 2-day recovery time. And that's what we're seeing the pendulum shift toward, no downtime with results. So the history of facial rejuvenation procedures dates back to when I first started my practice over 20 years ago with ablative CO2 resurfacing and peels such as the phenol peel. And this resulted in great results, but a tremendous amount of downtime. It wasn't uncommon for patients to tell me that they wouldn't do it again. And so even though you saw the results, it was hard to get another patient referred by this existing patient because of the downtime. So what evolved from that into the early 2000s was fractional resurfacing, the concept being less downtime by leaving areas of uninjured skin, and then the results were not quite as significant. And still the patients were pushing for less downtime with still appreciable results. And that's what we're seeing with Secret RF today. Very minimal downtime, but substantial results. And that's what the patients are most satisfied with in this millennium. So we're going to discuss the Secret radiofrequency solution. The Secret RF Microneedling system is a tailored approach to skin revitalization, which combines bipolar radiofrequency energy and small microneedles to stimulate and remodel collagen and address the common signs of aging on all skin types. 4 major categories: fine lines and wrinkles, photoaging with dyschromias, various types of scars such as acne scars, burn scars, atrophic scars, and stria or stretch marks. This is an artist's rendition of the difference between younger and older skin. And what we're really targeting with Secret RF are textural issues like we just mentioned, scars, superficial type issues. So what you see with the skin aging is a loss of organization and density and structural support of dermal structures, such as hyaluronic acid, water content, oxytocin, fibroblast, and collagen support. So as we age, wrinkles develop because of the loss of these structural issues. What makes Secret RF different is that there are 2 handpieces giving options for efficient treatments even in large areas and precision in small areas, on and off the face. The larger area is treated with 64 pins needing needles and or 25 pins. There are 2 types, insulated and non-insulated, and you pick these tips depending on the type of treatment that you're targeting as well as the skin type. The adjustable parameters are tailored for each individual patient. The parameters are depth of penetration, measuring from as shallow as 0.5 millimeter to 3.5 millimeters, the delivery of radiofrequency energy in terms of milliseconds, 50 to 950, and then the repetition rate, which is adjustable depending on the comfort of the provider. And then one other parameter is the intensity. So the clinical advantages of Secret RF are that, one, it's a multi-layered remodeling from the inside out. There's a precise delivery of fractional injuries and radiofrequency injury, thus leading to quicker recovery time. The use of non-insulated and semi-insulated needles helps target specific endpoints, and then a very intuitive interface to allow for customized treatments, but also with preset parameters to keep it very safe if you decide to delegate this device. The concept of multi-layered remodeling from the inside out allows you to target different endpoints, such as superficial lines, which are treated with less penetration and perhaps a non-insulated tip, whereas when you're going after scars, superficial and medium depth treatments, and then stria or stretch marks, which require deeper treatments, but also superficial treatments as well. That's what makes this device quite versatile. Secret RF allows very precise delivery of fractional injuries and radiofrequency energy. The cartridge is placed very easily on the skin, and then the microneedles penetrate the skin smoothly with what's called a solenoid device. Then bipolar radiofrequency energy is exchanged between the tips. This denatures the tissue, and then in response, collagen is regenerated and new elastic production begins. This video shows you the difference between a smooth solenoid type device shown above, which is a Secret RF, and then some of the older devices which were not solenoid and not so smooth, causing much more pain primarily and lack of safety and predictability. The secret RF allows very precise delivery of the fractional injuries. The needles penetrate the skin, as we mentioned, in a very smooth fashion using a solenoid device. And then using different lengths and intensities, it's easy to customize the area of treatment. This adds to patient comfort compared to some of the older devices, which were much more painful. The ability to choose between non-insulated and semi-insulated needles allows you to target certain endpoints. Non-insulated needles allow energy to be delivered from the base of the needle to the tip, approximately 50-50, and this gives more of a resurfacing type result. The semi-insulated needles deliver the majority of the energy to the tip, approximately 80%, and this is very useful in darker skin types, such as Fitzpatrick 4, 5, and 6. This slide is showing you the different methods of delivery of the heat using non-insulated, where you see heat injury from the surface to the end of the needle, and then in the insulated to the right, where the heat is primarily delivered toward the tip. This picture is showing you the intuitive interface, making it very simple to use preset parameters, keeping it in the safe zone. User can select customized settings, and then you can actually save in the memory settings that you use for that particular patient. Now we're going to go after some of the money slides because all providers need to see pictures, and that's what helped me become a believer in this device. I believe I purchased the first secret in the country at the end of last year. This device was developed in South Korea, and if you are familiar with Asian skin type, it's a very challenging skin type to treat safely, and that's what gave me a comfort zone. But the pictures show everything, so this is an example from another clinic. The types of results you can get with textural improvement. Certainly this patient suffers from a good bit of acne scarring, as well as fine lines. I think you'll notice an improvement in her dyschromias, which are primarily reds. This is an example of one of our patients treated at our initial session, and we wanted to demonstrate what a patient looked like right after the treatment. The benefit of secret RF is that unlike cold needling, the holes that are made by the needles are sealed with heat. So shortly thereafter, they can get into makeup, and the amount of downtime is very minimal. But right after treatment, they're going to be quite a bit red, and you have to explain that to them. You'll notice the parameters we use, the intensity, the percentage of RF, and then the RF time is in milliseconds, and then the depth is the penetration of the needles. And then here's that same patient after she's healed. We'd like to take our pictures 3 months afterward. They're probably pretty well healed after about 6 weeks, but just to be compulsive, I think it's very important to use consistent photography, facial head positions and expressions, lighting. Using a photography room, I always find is beneficial. The patient had some surgery, but she also had a traumatic scar on the left side of her face that she was bothered by. So I think you see some improvement below her left oral commissure, as well as the texture of her lower eyelid skin. And so this is just the 3/4 view of that same patient. And when you're dealing with traumatic scars that are older scars, it's a little harder to get excellent results. It's important to inform them. It might take multiple treatments. But she saw some improvements and was satisfied with just the one treatment. And here's another example of one of our first patients using the preset conservative parameters. And you'll notice a marked improvement in her dyschromias. She suffers from a good bit of flushing, a lot of telangiectasias in the face, so we treated full face and neck. She also has a bit of acne scarring, and that has improved too. Again, just a 3/4 view of that same patient, showing a pretty marked improvement in the erythema of her face. With the heat, you're actually sealing the superficial telangiectasias and capillaries, and that's why I think you're getting marked improvement in redness. And you see in this patient general improvement in color as well. He's gotten much improvement in the reds, and just a general textural improvement in his skin, just has a healthier glow. This patient appreciated some improvement in textural issues, especially in the lower eyelid area, perioral area, and just, again, a healthier glow to her skin. Same patient, three-quarter view, same issues, improvement in eyelid skin texture as well as perioral. Notice the chin area. What was impressive to me with this patient was a status post facelift, but we actually achieved some tightening of the submental skin. It's very critical that you have consistent head angles as you evaluate these types of results. So this patient suffered very traumatic injury with a chainsaw to the right side of her face, and so we have since treated her a second, if not a third time, each time noticing improvement in that cheek scar in the mid-cheek area and right perioral area. This is a patient of mine who was very bothered by the fine lines, especially that vertical line on his left cheek. I call that the pillow crease. You sleep on one side and you tend to age more on that side. But we were able to get marked improvement in the horizontal forehead lines, and I even think that we got a bit of lifting, especially in that mid-forehead. I think with, even it's not an indication, I think we're getting some heat that cause contracture. So I think that we're getting a little bit of lifting, and I think his jawline looks better as well. This is the same patient, three-quarter view. You can just see a general improvement in the texture and healthy appearance of the skin. And then again, just a profile view, just to get a global assessment. I always like to take a frontal, three-quarter, and profile view and evaluate all our patients with all those angles. And again, in this patient, I think we noticed a good bit of improvement, not in just textural issues, but notice her jawline. Feels like we got a bit of a lifting type result, and the marionette lines are a little shallower. All the perioral lines, the pucker lines are improved. This patient was quite happy. Same patient, three-quarter view, showing you improvement in the jawline and even in the neck. And this was non-surgical, no downtime, but I think very decent results after one treatment. Now, this is one of our home run patients who knows marked improvement, especially in the periocular area, perioral area, and she's already signing up for another treatment. This is just one treatment. This is an example of treating smile lines from another clinic. Notice with smile lines, they're very superficial. This is a very difficult area to treat with filler and get an adequate result. You really have to remodel by building collagen from the surface down. So this is resurfacing, but not really having to ablate the skin. And that's the beauty of Secret RF, is you're resurfacing from the inside out. Again, note marked improvement in textural issues with fine lines and a bit of acne scarring in the chin. Notice the upper lip lines, lines in the cheek. Notice in this patient the improvement in the crepiness of her textural issues of the neck, as well as the dyschromias. A marked improvement in the redness and a decent improvement in the darker pigmentations. This again is showing improvement in textural issues, but note the jawline. That is giving a bit of a tuck-up result in my estimation, and I do a lot of facelifts. So I like this device because I'll take a facelift and make it better, or if I do it prior to a facelift and build collagen, it makes the facelift hold better. In this patient that was treated acutely with a fresh scar, it's easier to remodel collagen in that scenario than the very mature traumatic scar you saw earlier. And this is one of my favorite indications because prior to Secret RF, there really wasn't an excellent technique to treat stria or stretch marks. And this is really exciting because the indication population that suffers from this is humongous. So just from a business standpoint, some of the reasons I brought Secret RF into my practice: the return on investment is spectacular. Low consumable costs, $70 to $80 per tip per patient, with the treatment time taking approximately an hour, allows us to charge approximately $1,000 or more, and we've actually doubled and tripled that if we're covering more area. And the beauty of this device is it's delegable. So I have my nurses, estheticians, and mid-levels perform this, and I'll assess the patient with them, but I don't use this device in my own hands. It also has the ability to treat a wide range of patients with all skin types and various concerns. And it has shown to have very safe and proven results. And so with the patient having minimal discomfort, no real visual downtime, and actual results, this has become a thrilling device to have in the practice, and the patients love it. There are some patients who will need analgesia, and so just as an aside, I'll recommend that you offer topical anesthetic. We custom compound benzocaine, lidocaine, tetracaine, and we like to leave that on for 45 minutes to an hour prior to the treatment. And then if you combine that with a patient who needs a little extra boost of nitrous, that seems to do the trick. Very, very few patients need oral sedation or nerve blocks. But if you need to do that, then just have the skill to be able to do that. This has really become an in-demand procedure. I oftentimes get asked, how are we successful with our Cutera Secret RF device? And frankly, the vast majority of patients just came from internal marketing, talking about it with our various providers. And we have a good dozen providers in the clinic. So if you have knowledge and explain to all your staff how to promote this device, it's fairly straightforward. It fits a niche that we really didn't have before. Everything's online nowadays. Internet is very powerful, so obviously you want to have this on your website. Social media helps. And if you are so inclined, because it's fairly rare in the country still, traditional marketing can work as well. But we've been able to heavily rely on just internal marketing.
Thank you, Dr. Yune, for this informative webinar on Secret RF. We have several questions that come in for from our webinar audience, and we've got a few minutes to go through these. So I will ask you some of the top questions that came in. The first one is, how would you describe the procedure? How would you describe the procedure field?
The procedure is not painless, because if you don't develop enough heat, then you're not going to get a result. But our patients will quantify this on a level of between a 3 to a 5 out of 10, something that's easily tolerated by using the topical anesthetic. Benzocaine, lidocaine, tetracaine, custom compounded is our preferred method. And applying it 45 minutes to an hour before, we've never had a patient not be able to get through it. Sometimes you have to give them some pauses, and we also offer nitrous if they need it. But very rarely do they need a narcotic or a benzodiazepine. And this way they can get their treatment and drive themselves home.
Great. Second question is, what other areas do you treat other than the face, and what type of results have you seen?
We've seen very nice and promising results all over the body. Wherever there are textural issues, I think this device can be used safely. So very common areas are postpartum bellies, or nowadays with all the weight loss patients, just abdomens in general, triceps, biceps, areas above the knee. I think any area can be treated safely from head to toe.
Fantastic. Now, what is the advantage of having non-insulated and insulated tips available?
Well, the non-insulated tip allows you to deliver predominant energy to the tip of the needle. So if you're dealing with things such as deeper acne scars, stretch marks, and you really need to build up collagen in the deep dermis, that's where you go. But if you want to help remodel superficial skin, epidermal skin, then you need to apply the non-insulated tip, which is a very mild form of ablative, if you will. But leaving fractionated islands of skin in between it allows it to epithelialize so quickly that the downtime is very minimal. It really depends on the indication, and we're using both insulated and non-insulated in just about every patient.
From your experience and your knowledge of the aesthetics world, what future applications do you see microneedling being used for?
Well, I think as we get more comfortable with especially lighter skin types, being able to apply it with more intensity, because I think if you saw in the demonstration with the pictures, we're actually getting some lifting. We're getting tightening of the full face skin soft tissue envelope from brow down to clavicles, and it's creating like a tuck-up type look. I think we're even getting a little bit of brow lifting and jawline tightening similar to other devices, and maybe even superior. But like I said, when we're in the first people to have this device in our hands, so we're experimenting and going slowly. I think it's important to go slow and steady to keep it safe, and going with higher intensity, you need to start on the fairer skin types to make sure you're in the safe zone. I think we're going to be able to get tuck-up type results with this.
That'll be great to see when you get some results from those procedures. So as a plastic surgeon, what advantages have you found in introducing Secret RF into your practice?
Well, the pendulum swung to non-invasive, non-surgical, and that's really what people are asking for. And so what you have to do in this marketplace is make sure that it's still giving them results. So having done this for over 20 years, most companies will come to me with everything, and I have to be a bit choosy. What Secret has really filled for me is a niche that I didn't have before, because I used to do ablative resurfacing, and I gave that up because it really, frankly, is a good result, but not a happy patient. Tons of hand-holding. What this does is it fills a gap for the non-surgical patient that wants that resurfacing type result. And I'm, as I mentioned just a minute ago, a tuck-up type result without downtime. And that's quite remarkable, because most of the minimal to no downtime devices that I've come across in the past didn't give enough of a result. So I did not bring all that technology into my office, because to me it's ultimately about a happy patient, them perceiving good dollar value, and that's what this has brought to the table for me.
Great. Next question. When would you use different depth penetration of the needle, and for what indications?
Depends on the skin type. With darker skin types, you want to stick with the insulated and delivering energy deeper. If it's a issue where you need to develop much more collagen, you layer it using various depths of penetration. So again, for things like stretch marks and deeper traumatic scars, acne scars, you're going to hit it with multiple depths. For fairer skin types, you can hit that surface with a non-insulated needle. So the more heat, the more injury, the more the result. And it's an art form as much as it's science. So you really have to get a comfort level with this. But the preset parameters keep you safe. So if you stick with those, you'll get a result. And then as you and your providers get more comfortable with it, you'll be able to apply energies at all different kinds of depths and different intensities. And you'll see better results as you get more experience with this.
Great. Next question we have here is, where does a Secret RF fit in with a practice that already has an IPL and non-invasive fractional devices?
Well, I think it's kind of a blend of both, because if you saw in those pictures, we were able to demonstrate improvement in dyschromias, browns and reds, and so that's similar to a photorejuvenation type treatment. But we're also getting the textural improvements you're seeing with non-ablative fractionated devices. So it's kind of an all-in-one. I have access to all those devices, but we're seeing that we're replacing a lot of that with just this one device. So the Secret RF is a device that is very versatile, because it gives you results much like an IPL and non-invasive fractionated treatments all in one. But the beauty of it is you can use it in all skin types. If you understand how to use the safe parameters that are preset, you can apply it to your entire patient population.
Perfect. So we have a couple of questions. We have time for a couple more questions. How are you combining Secret RF with other procedures that you offer in your practice?
Well, we offer Secret RF to just about everybody because it's applicable to everybody. So from the person who's coming in for the least invasive treatment, like a light chemical peel, they don't really understand that they can accomplish something much more significant by doing this type of device with less downtime. Injectable patients all love it because you're really not getting textural issues with fillers or neurotoxins. And then the surgical patients love it because it takes their results and makes it even better. Or like I said before, it can actually prep them for a better result by giving a better texture and thicker skin type, which holds better after surgery. So it can be done before or after surgery. There really isn't a patient it doesn't apply to.
Next question is, has Secret RF in your practice helped increase attracting different demographics or other demographics such as men, since more men are becoming interested in aesthetic procedures?
Yeah, I do think that it actually works very well on the male patient. Since the male patient typically has a thicker skin type, they seem to respond even better to heat-based devices, and many men do suffer from textural issues. And like in a surgical practice like mine, there's not a lot of men who pursue surgery. My practice is 95% female, so this has opened the door to the male who does not want to have downtime but still wants to get a result. I just did a anchor man on the TV recently, and he called me and was thrilled because he can't get the downtime for surgery, but he saw a decent result with just this device with one treatment.
That's a beautiful answer. Thank you. Okay, so okay, we have time for two more questions here, and one of the questions was, there's a lot of microneedling pens out there with no RF, and it's a lot less expensive technology to adopt. How do you compare that with Secret RF?
Well, I've had what I call cold needling device for many years, and Secret RF for just under 1 year, and it really doesn't compare. There is indication to have cold needling in your office, and that's for the patient who has filler. Because if you want to go after deeper indications like acne scarring, traumatic scarring, then you will potentially, what I've seen clinically, dissolve some of your fillers. So it's important to do this device prior to filler and to map out a treatment plan with a patient. The issue, though, is convenience, because with cold needling, you have to do 6 to 12 treatments to equate to 1 to 2 secrets. The downtime is also markedly different because cold needling doesn't seal the holes, so patients have to be prepared to be red-faced for 5 to 7 days or even beyond that, whereas a secret patient, more like 2 to 3 days. And so both can get into makeup sooner than ablative technologies, but so number of improvements using RF for sure.
Great. So, Dr. Yune, one final question that we have time for, and the question is, what impact has Secret RF had on your financials, specifically ROI, and has it been a profitable device that was added to your practice?
Yeah, the answer is yes. I've been very pleased with our ROI. That's always important from a businessman standpoint. The beauty of it is it's delegable, so I don't do the device myself. And what's really made it easy to delegate is that the PDM program from Cutera has been excellent. There's a lot of support, so my providers that do the device are extremely knowledgeable, and it's not a single training session. There's constant involvement, so there's an extreme comfort level with it. I've been very pleased with the program and the company, and they've definitely had my back, so I'm ecstatic about our purchase.
Well, thank you very much for your time tonight, Dr. Yune, and thank you very much to the audience. This webinar will be available on our website archive within 30 days, and the rest of the questions that have come in that have not been answered tonight will be answered to you by email from a Cutera representative. Once again, thank you very much.